Awesome. So again, welcome to today's town hall. I am Ken Kettenbill, Vice Chancellor for External Relations. For those that don't know me, we were scheduled to have about 335 guests today, and I know people are still coming in. We're going to go ahead and get started. Just a reminder, this is being recorded, and we will post the recording. We will have a link in Reporter very soon, one day next week, so you can either rewatch it, or for those of us on campus that were unable to make it today, can watch it at their leisure. Today we are joined by Chancellor Grasso, Provost Sue Elcock, Vice Chancellor for Business Affairs Brian Dady, and we're very honored to have our Chief Medical Officer for U of M, Dr. Preeti Malani, with us today. So welcome. A lot of questions for you, Dr. Malani, as you can imagine. So we look forward to your responses today. And then we also have some additional colleagues that are on the call in case there's questions that we need help with answering. And that is Amy Finley, Rima Berry-Hung, Mitch Sullenberger, Laura Drabchek, Carol Glick, and Maureen Linker. So thank you all for joining us today. So with that, I'm going to turn things over quickly to our Chancellor to open things up. And Domenico, welcome. And you, we shared some big news today, and it really answered a bunch of questions we received as well. So go ahead, I'll toss it to you.
Okay, thanks very much, Ken. And I want to thank everyone for joining us. But even more importantly, I want to thank everyone for doing such a terrific job in keeping us safe this semester. We've had a very successful semester with very few cases that we can trace back to our campus. So we've been very fortunate, and it's in large part due to your conscientiousness. We also returned athletics just a couple months ago to campus, and they have been super conscientious as well. We've had a few positive cases, but all in all, we've had a positivity rate in athletics of 0.8%, which is terrific given the fact that in Michigan, we're over 12%, in Wayne County, we're over 14% right now in terms of positivity rate. So I want to give a great call out to our athletes and to our athletic staff there as well. Next week, we've got some exciting news for all of our students because we're going to have commencement, and we're going to try to bring folks back to campus, both our 2020 graduates and our 2021 graduates. We're going to do it outside, and we're going to do it in small groups, a number of different ceremonies. The provost and I are going to share the MC duties, and we're very excited to see everybody on campus again, hopefully in another safe activity on our campus, and to recognize all the hard work that students have put in over these years, especially this past year. As Ken alluded to, we have some news that we announced this morning about what's going to happen in the fall. And to accommodate as many options as possible, and at the same time ensuring the safety and health of our campus, we're going to require that for everyone who comes to campus starting September 1st, faculty, staff, and students, that the individuals coming to campus have proof of either a vaccination, an approved vaccination, or a negative PCR COVID test in the last week. So if you do not want to get vaccinated, which I hope you decide to get vaccinated, I was right up the front of the line when I could get vaccinated, and I know Dr. Malani has been as well. If you can get vaccinated, please get vaccinated. But if you don't get vaccinated, we're going to require negative PCR tests on a weekly basis. And you'll be able, we have posted where you can get that done for free off campus. And we've also posted where you can get the vaccine for free off campus as well. And the last thing I want to say before I open it up is we are continually monitoring our budget situation, enrollment, state appropriations, everything that is going to impact next year. And we still have our fingers crossed for a modest merit increase for our faculty and staff that have worked so hard. And even though we're going to try to do that, it will in no way be reflective of how much gratitude that we have for all of you in everything that you've done to get us to this point. So with that, Ken, I'll turn it over to you. I, of course, will stay very attentive and ready to answer any questions. But I know that we've got some outstanding talent on the call as well that are better equipped to answer many of these questions. So Ken, it's all yours.
Awesome. Thank you, Domenico. Just a reminder to the people on the webinar, if you have a question, please use the Q&A feature down at the bottom, not the chat feature, the Q&A feature. We will get to those after we have some brief remarks from all of our panels. So reminder on that. Sue, I will throw it to you. I know that we're winding down this semester, but the summer semester is knocking on our door. So if you wanted to just give a brief update on where we stand with our planning and maybe how enrollment looks and those types of things.
Happy to do that, Ken. Yeah, I know we're all in some ways looking down the road to the fall, but I am here to talk about the summer. Just in a nutshell, a little less than 7% of our classes will be in person for our summer sessions. Nearly all, you won't be surprised to hear, are concentrated in the College of Engineering and Computer Science and in the Natural Sciences in Castle. Largely remote, 7% on campus. How are we doing with enrollment? Well, we have about 2 weeks to go, believe it or not, until the first summer session, summer one. And I'm happy to say enrollments are in line with our projections. If you compared like a 5-year average of summer enrollment at the same point of time, like about now, we're reflecting about a 5% increase in the overall number of credit hours signed up for. This accords with our thinking, or I should say the Division of Enrollment Management thinking, where they've been planning conservatively for the summer, not assuming as strong in numbers as we saw last summer. Summer 2020 really knocked it out of the park, but we're still looking for an increase over pre-pandemic years when, of course, we had fewer available online options. And also keep in mind that summer 2, which begins late June, can continue to gain enrollment. So our numbers are still in flux. I'd also just like to say quickly that other cool and useful things will be happening over the summer, largely virtually. Our summer undergraduate research experience, SURE, will be operating with 26 projects from all 4 colleges. They'll be up and running. Some fabulous, wonderful things going to be happening this summer. A lot of assistant professors involved, I'm very pleased to see. There will be an announcement soon of a graduate writing summer camp. And there is also, remember, our pilot of K-12 tutoring for the children of Dearborn faculty and staff. And all of these are being organized under the umbrella of the new Experience Plus group in the Mardigian Library. And this Division of Student Affairs, I should add, will also be continuing their ongoing and superb efforts around COVID support, food pantry availability, and various counseling and mentoring opportunities. So, the campus will be all go for summer. And I'll give it back to Ken.
Thanks, Sue. I remember last summer, our enrollment figures were really good. It was one of the positive bright spots, that happened, as we were in the beginning stages of the pandemic. So that's great news. Next, we'll throw it over to Vice Chancellor Brian Dady to talk a little bit about the budget, where we stand. I know we don't really focus in on, well, you focus in on it all the time, but it goes to the regents in June for approval. So we have a little bit of a window there. But Brian, if you just wanted to give a financial update on the health of the university.
Thanks, Ken, and good afternoon, everyone. Yeah, not much has changed since March when we reported to the regents. At this point, we have a balanced budget scenario based on a few assumptions. One, a slight increase in the base tuition of 1.9%. We did assume that the state appropriations would increase by 2% based on the governor's recommendation. And we're closely monitoring everything, as Chancellor Grasso said. That's based on our initial enrollment projection. We are going to meet with enrollment management at the end of this month to update those projections, which will then update our revenue projections for the budget. We will then be preparing a presentation for the regents in May with the updated scenarios. Today, the House and Senate subcommittees announced their plans. Both of them had a 0% overall outlook for higher education. House presented a new model. Don't know if that'll get much traction, but I think it's highly likely we'll see a 0% scenario for higher education, but we'll continue to monitor the situation. And then, like you said, Ken, the final budget gets approved in June. So that's about where we're at. Not much has changed.
So good. Thank you. Thank you. And finally, not least, but Dr. Malani, if you wanted to talk a little bit, about where we are with the stages of the pandemic. We're all aware that Michigan sort of has been in the news for all the wrong reasons, with the recent surge that we're experiencing. The good news is looks like numbers are starting to drop a little bit. But your thoughts on where we are currently with the pandemic, what you anticipate happening over the summer, and I know none of us have a crystal ball, but any thoughts you might have for the fall?
Yeah, sure, Ken, and thank you for having me. I know the leadership team knows this, but I'm from not too far from Dearborn, and actually spent many hours on campus as a as a youngster, and actually I think I had like my own table at the Mardigan Library at one point. So it's nice to hear about that. Anyway, it's good to join you. And again, what's happened in the past year is really trying to adapt campus for the opposite of what it's built for. It's built for community and togetherness, and we've told everyone to go away. So it's really great to even think about what the fall is going to look like, and it's actually good to reflect on all the things that have been done. And as Ken said, Michigan has had troubles in the past few weeks, gone from having some of the lowest numbers of COVID cases to having the highest in the country. And that rate of increase is what was very alarming. And thankfully, it has corrected a bit, even in the last couple of weeks. But a few weeks ago, the statewide positivity rate was about 18%. It's still 13.5%, which is still too high. And there are communities that are truly like overrun with patients in the hospitals. And in fact, they're having trouble staffing the hospitals because so many healthcare workers are sick. Unlike prior waves, we are seeing large numbers of cases in younger people, teens, even children. And we are seeing people at Michigan Medicine who are younger. Almost always they are people who are unvaccinated. And now that vaccination has been open to everyone in our state, and it's happening. It's a slow process, but there have been more than 6 million doses of vaccine given. And we have to, keep going and try to get everyone vaccinated. One thing I do know that I reflect on is people who are getting infected right now are people who made it through a whole year without getting infected, and including some of our students. And it gets at how hard this is. You can socially distance and mask for so long, but eventually we have to really focus on vaccination as being able to get back to something that feels closer to normal. The B.1.1.7 variant, there's been a lot of talk about that. It's been widespread in Michigan, and it's likely what has made Michigan a little bit different than the surrounding states. But the other things that have happened in our state is that large groups of people have gotten together without social distancing, without masks, often indoors, where 50 or 60 people could become infected, in one event. And Ken, you mentioned athletics, and I've been talking with Brian regularly, trying to do the impossible. And by the way, congratulations to the athletes who I know several had a good abbreviated different season, and that I know some have qualified for the championships, regional and national. And the athletics and sports in children and in youth have been linked to a number of cases. But again, it's not the competition; it's the social stuff that happens. And if those of you who are parents, as I am, of young adults, the sports, it's not really, it's about so much more than the game. It is that social activity. And, frankly, that is also a very, very important thing for health. So, trying to recreate things is difficult. Where do I think things are going? I'm very optimistic about where we're going. I will say right now, there's not a lot of room for error because community spread is so high. I worry that Michigan might be a warning sign for other states. It might be that we're just ahead of the curve as we were last year. So my advice to people is, especially in public, keep wearing your mask, avoid big crowds, be careful. Outdoors is great. And now that we have access to safe, highly effective vaccines, really make your plans to get vaccinated. Hopefully people have done that. I say this every time, vaccination doesn't just help you, it really helps everyone around you, which gets at some of the news that came out today. And I am very supportive of the plan that you've laid out. I think it's a remarkable thing how fast this has really happened, but it's because all the resources that we had were put into vaccination, and now we've had 220 million doses given, and it's really a remarkable number. I know there may be some questions about the J&J vaccine, but like I said, I am really optimistic that the fall is going to look and feel a lot closer to normal. I think we do have to contingency plan. We have to stay nimble, and we all have to just continue to be patient, even though we want to be done with this. I mean, I certainly want to be done with this, but thank you to everyone really for all that you have done to get through this extraordinarily difficult time.
Oh, thank you. And no, your message about the vaccine, doing it for other people, I mean, that was very much aligned with the mask wearing request, do it for other people as well. So it's very consistent. And I agree with you about the spread being with younger people. My wife just texted, and our school district's going remote next week because they have too many kids with COVID. So it is crazy. We almost made it through the whole year. So thank you very much. So we are going to quickly go into Q&A. Just a reminder, if you have a question, put it in the Q&A tab. Domenico, I'm going to serve the first one up to you. We're starting to get lots of questions about how are we going to track if people are vaccinated, or how are we going to check if they've had a negative COVID test. And, I know we have a lot to figure out still. Today was the announcement, and I know you wanted to give us a long runway to get a lot of these details figured out, but did you want to comment on those types of things and sort of timelines to where we might be?
Yeah, we don't have everything worked out, Ken, as you said, but we were conscious of people wanting to know what's going to be required and how they're going to be kept safe in the fall, so they can start to make plans. So we wanted to at least outline what our plans were to keep people safe. How we're going to actually execute it, those details are yet to be worked out, but we are going to be looking for evidence on a weekly basis of either vaccination or a negative COVID test. So we're going to have to figure that out. We've got a lot of very smart people that are on a senior leadership team, and I know that they'll be able to come up with something that's going to be facile and protective.
And I know, just because I was part of some of those conversations, there's other aspects like events on campus and visitors coming to campus and prospective students coming to campus. I mean, we know there's a lot of audiences and a lot of different areas that we have to sort through and really dig into developing a good policy and procedures to keeping the campus, continuing to keep the campus safe.
Yep.
So, Dr. Malani, we received questions in advance, not just for you, but for all the panelists. And then I'm watching some of the questions come in now. So I hear this question frequently. So even if you're vaccinated, it doesn't mean that you can't transmit COVID to another person, correct? So can you talk about that? And how would you address that? Because we hear that often in the news as well.
Yeah, so I think a couple things is, one, the vaccine is highly effective and it's extremely safe. And we talk about vaccine efficacy, and then we talk about vaccine effectiveness. And we are seeing cases, and again, millions of people. And we're talking about a few thousand cases that are well documented of breakthrough. And when there's a lot of activity in the community, you are going to see a few breakthroughs. Most of those have been asymptomatic. Hardly anyone has been hospitalized or ill. So that's one part of the question, which is, can you still get COVID if you are vaccinated? You can, but it's rare. And if you do, it's mild, almost always. And can you transmit? The question is not totally clear yet, but it looks like it's very unlikely that you can transmit. And the CDC, as they gather more data, will probably come, that's part of the whole reason right now why masking is still really important. We may get to the point where we don't need masks, and outdoor masks, I think especially will likely be gone sooner than later. Just to take a minute, the CDC guidance, and the CDC is very conservative in their guidance because they really want to be right. They don't want to get out and then have to backpedal. If you are fully vaccinated, you can meet with other people who are fully vaccinated indoors without social distancing Without masks, you can hug and kiss your friends who are vaccinated. And I think that's really an amazing thing. That's been amazing for families who haven't been able to see each other. If you're fully vaccinated, you can also meet with a household that is not fully vaccinated, one household indoors, as long as they're of low risk for complications. And that is grandparents seeing their grandchildren who are not eligible for vaccination. That's what that was designed for. And I think, what we're finding is that, again, like, should 50 or 100 people get together? I'd say at this point, no. But you know what? You can get together with your family if they're fully vaccinated. And you don't have to have, you can have confidence in this. So it gets back, Ken, to that question of, can you spread? It's maybe, but it seems like the viral count that you would have if you are fully vaccinated is so low that your ability to transmit is also low. And if you're around people that are also vaccinated, you're not going to spread it to anybody. And that's a long, drawn out explanation, but hopefully the point is that it might happen, but it's not like, especially if you're in a highly vaccinated community, which gets at the need for being highly vaccinated, is that if someone does have an asymptomatic infection with very little virus, they're not going to cause an outbreak.
Thank you. I'm gonna sort of stay on the topic. We're getting a lot of questions about mask wearing, and maybe Laura, if you wanted to address, what we anticipate our campus policies and procedures being in terms of social distancing, mask wearing, and those types of things for faculty, staff, and students.
Yeah, thanks, Ken. Our policies will pretty much be the same. We're going to have mitigation strategies in place for the fall. We're going to ask folks to continue to mask while they're on campus. We're going to ask that they, continue to take all the necessary COVID precautions, good hand hygiene, and those are going to be our mitigation strategies moving forward. They're still going to be asked to do response blue.
We anticipate the temperature checks and health screening that probably will not happen in the fall, correct?
Correct.
And again, a lot of work that has to happen between now and September that will quickly start happening probably Monday in some areas.
And could I just follow up on something that Dr. Malani said, because I was just looking at a study that said that there were 5,800 breakthrough cases out of 77 million, which comes out to a breakthrough of 0.007%, which means that the vaccine is over 99.993% effective right now. So it's even higher than what was originally reported based on these vast numbers.
Another question, probably for you, Dr. Malani. What? Not probably, definitely for you. We hear this a lot. If a large percentage of the UM-Dearborn community is vaccinated, can we achieve herd immunity? And what percentage would we need? And I guess I'll have a follow-up question on that. I mean, that's great. That's our community, but we don't live on our campus, and then we go home to other communities. So is that even possible to have herd immunity on the Dearborn campus?
Yeah, so I think some of this is there's not this moment where we hit herd immunity and now we can just like stop everything, because it's a dial. When a year ago, when we shut down, it was a switch. We just it was fine one day, and then one day it wasn't fine. And I think the way it hit us was really surprising. I still think back to those days, and I'll never forget how quickly it changed. Getting back is a lot harder, and it's a lot slower. We're talking about numbers of 70%, 80%, 90%. I think if your campus is in the 90-95% range, you're really not going to be seeing transmissions. You can do things like, you have less distancing. You'll be able to not have masks outdoors. Not yet, but I think this is where we'll head. The athletics will be able to get together and work out, and they're not going to have to worry all the time about the things they're having to worry about. You'll be able to open up more venues. You'll be able to be in classrooms and feel safe. But you're right. People, their home is different, and that's been one of the unique things, one of the unique challenges, particularly for the Dearborn campus, because of who our students are and where they live, and that often in multi-generational households with vulnerable older adults. I think it really has to be all of us. And it can't be that, well, this one county has 20% and then this county has 90%. And I worry that we might end up seeing that a little bit in Michigan. That there's some counties that have not really done a good job with vaccination. Now, Wayne is okay. Oakland is excellent. Oakland's like one of the best in the country, and I think it has to do with education and money, and those are the people who really accessed vaccines early. Washington's pretty good too. So I'm hopeful that we're gonna, as a community, as like a greater Detroit, Lower Peninsula, kind of the mid-Michigan area, we're gonna be good, and that we're not gonna see a lot, but we're still gonna have kids that are unvaccinated for a while. I know there's a question about that. Kids are safer when everyone around them is vaccinated, but it doesn't mean, and fortunately, they don't do poorly overall, but we have a lot of kids right now that are sick because so many of them have come into contact with this. So your campus, we're not going to be able to completely throw everything away for the fall, but I think we're going to get close. And of course, the United States is just one part of the world. And unfortunately, this is not anywhere near done in the world. We're not done in the US either, but we're going to be in a much safer place. Two different scenarios keep me up at night. Well, a lot of things keep me up at night, but with the vaccine, there's two things to kind of keep in mind is when people ask, well, we're going to need boosters and things. And I think we just don't know. We know that the vaccination is good for at least 6 months. It may be much, much longer. What we measure in terms of antibodies, that's only one type of immunity. There are other types of immunity that are harder to measure. And so we have to see like what happens. Do people start having breakthrough cases? And if they do, no big deal. We'll do boosters. We'll manage that. I don't think we're going to go back to where we were a year ago, which is one of the things I think a lot of us worry about. I don't see that being the scenario. I see it being like this, maybe a little bit better, and then a lot better. The other piece is if there is a variant that were to really take off, that would break through the vaccine. And that's a theory. So far, that hasn't happened, at least with severe infections. And I'm hopeful, but that gets at the reason why it's not just vaccine and you're done. It is also the mitigation. So long answer. Sorry about that.
Oh, it's complicated stuff, so thank you. Reem, I'm going to throw these next questions over to you, a couple of them. Questions about, do I have to come back? What does remote work space look like? And do we anticipate some of the hybrid and remote work arrangements continuing beyond the pandemic? So from an HR standpoint, did you want to comment on those questions?
Yeah, absolutely. So this is definitely something we've been thinking about. We are working across leadership in areas across the entire campus to look at what the future of work could possibly look like. We're definitely assuming safe measures are in place so that people can come back safely. It's going to all depend on what you do. What does the body of work look like? And then we want to absolutely support the mission of our, serving our students, but then also ensuring that people have flexible work arrangements, right? We all understand that work schedules and arrangements are all going to depend on the presence on campus, the type of work we're doing, the students, and then we want to be flexible and be thinking about personal individual situations. We are definitely thinking about how we can be strategic in terms of setting up the work so that people can continue to be thinking about the future. I think we're very confident in what we've done this past year in terms of embracing a diversified workforce structure, and we want to build on that. So I wish we knew all the answers right now in terms of who's going to be where and what that arrangement's going to look like, but we're definitely looking at remote, hybrid, and on-campus presence, and with more to come in the future. So
Rima, we had a few questions, very individualized cases. Some parents of young children, they may be out of school for a period of time, so they may have to be home with them. Should they just work with their direct supervisors for special accommodations and arrangements for short periods of time?
It'll definitely depend. So if you're a faculty member, right, we are going to work, let me just start by saying we want to offer as much flexibility, right, for our instructors who are teaching that have young children, for our staff who are working that have young children. And we've communicated in the past few weeks and months about a process that we're trying to implement. So if you're a faculty member and you have a personal medical condition or dependent care responsibilities at home, that you work with the provost office in partnership with our office. If you're you're a staff member and you have, again, a personal medical condition or a dependent care situation or any number of issues that could possibly come up, you work with the HR office, and we'll work in partnership with your unit leadership and your supervisor to work through. We'll look at what's going on, what's the situation, what does an accommodation or an exception request look like. It's all going to be case by case because it's hard to apply one policy across the board, but we're definitely going to try to be really sensitive to that and try to come up with a resolution that works for everyone involved.
Thank you. Sue, this question for you. There was a question about, do we anticipate cultural field trips to happen for students in the fall? And, just an update on travel. And I believe there's some revised policies coming out soon regarding this, but if you wanted to comment on that.
Well, I'm all for cultural field trips. I'm really curious to know what folks are thinking about. I would ask for a little patience on that. I think there is some new guidance coming out about travel. I don't know if this is a long distance field trip that we're talking, but we'll nail that down and get out some communication around that very soon, as soon as we can give you good information. And whoever raised that question, send me an email. Let me know what you're talking about. I'm very curious to hear.
Thank you. Carol, the question for you, I believe, here on cleaning. What do we anticipate the fall looking like, and just how we're going to be cleaning? Any additional steps we're going to take? Are we going to retrofit bathroom faucets and doors and those types of things to alleviate touch? And I guess a follow-up question to that too, I know your team in conjunction with HR and supervisors across campus will be doing walkthroughs with leadership so they can go through their office space to determine what might need to change in order to keep people safe. So if you wanted to comment on those two areas.
Absolutely. So just a couple of things to talk about. One is that as always with all things COVID, this is a partnership that involves all of us. And so in facilities, we work to make sure that we implement additional cleaning protocols, that we're cleaning high touch surfaces, that we've provided hand sanitizer, that at this point, we've gone through all the buildings and looked at plexiglass for public facing spaces and students facing spaces. We've installed disinfectant and paper towels in common areas, and that's the beginning of the work. The next piece of it is how we as individuals come to campus and contribute to that overall safety. And those things are about making sure that we're always healthy when we come to campus, that we've done our responsive blue checks, that we are participating in the protocols that say if you are in shared spaces, you use that disinfectant and you wipe surfaces down when you come and you wipe surfaces down when you leave. It's how we all take ownership of the partnership that's part of how we come to campus safely. We are working individually with department leaders to have our facilities planning people go through individually in each department so that we can talk about the nuances of how you come to work, and we can make sure that spaces are safe for those types of activities. In addition, leaders are working at changing work times so that we can stagger spaces where people are typically close, so that we can work remotely. Partly, we can come to campus when we need to. We can adjust spaces for activities that require student-facing or public-facing interactions. All of these are part of this plan. In addition, before anyone comes to campus, if you're staff or faculty, we have online COVID training that everyone participates in, that just helps us understand the nuances of where COVID is at this time. We recognize that things will continue to change. This is a fluid situation. CDC guidance is going to continue to evolve as COVID cases. We will stay on top of that and do our best to walk hand in hand with what CDC recommends with us. We have adjusted ventilation. So we've discontinued the types of things like demand control ventilation. We purge every building for 7 days when we open it for occupancy. We've increased the purge times before building occupancy hours, and we've increased the MERV rating of our final filtration. So all of these are activities that we take again to protect against those things that aren't considered to be primary vectors for COVID transmission, but nevertheless are part of our overall strategy. That was a long answer. Did I cover all the questions? Are there more things?
You did. I think the only thing more complicated than all the medical discussion is the HVAC discussion that we have on campus. And there was a great article in Reporter a couple of weeks ago that explained it all, and I learned a lot. So just for people interested in that topic, they can go onto our news site. I think, I wanted to mention too, it's been communicated that, staff and others, that don't have to be on campus really won't be expected to be back until after the 4th of July holiday. And all that work that Carol just mentioned is going to be work over the next couple of months to make sure things are in place. So this gradual return back to campus is going to be safe and really vetted with a lot of thought. And as we continue to go, as we move closer to fall, there's going to be different guidance and policies that the federal government and health officials are going to share as well. I think that's fair to say. So let's talk about fall. I mentioned earlier, when the provost talked about what summer looks like. So, there's a lot of questions about, fall and, is it going to be safe and what are we doing to make sure that this transition is going to be healthy for all of us? So, maybe Mitch, if you want to talk about some of where we are with the teaching plans and some dates that we have circled to make some decisions by.
Sure, Ken. So since the last fall semester, we've actually been building and working on the plan for fall of 21. We came up with 3 scenarios that we wanted to make sure that the campus was working on to build, depending on where the COVID pandemic situation was when we had to pick a scenario for publication. So the first scenario was at the 15%. So no more than 15% of our classes would be in person. That's in person completely or hybrid. The second scenario was kind of mid-tier at no more than 50% of our courses would be in person. That's completely in person or hybrid. And then finally, we asked the colleges to plan for a scenario that we were called COVID transition. And we didn't pick a percentage per se. What we did is we asked the colleges to adjust their schedule and the courses accordingly to most effectively deliver our academic mission, right? To make sure that students are learning well. And so under that scenario, and the colleges just delivered it about 2 weeks ago, they delivered at a 62%. So 62% of our courses would be either in person or hybrid. Now, just to be mindful here, just because I say 62% are going to be in person, that doesn't mean, we're having the same type of percentage and student density like we did pre-COVID. So a lot of those courses are actually hybrid. So we'll have fewer than students coming on campus every day of the week, and I would say also another point about our fall scheduling, and I thought this was a smart decision on our part, is that we pushed back the publication date for the schedule until late May. So normally our schedule for the fall would already be out, but we pushed that back in order to give us enough time to decide which schedule we're going to pick. Because what we didn't want to do is we didn't want to publish the schedule, COVID goes sideways, and us have to readjust the schedule and have to do that to students. So we still have about a week and a half before we have to make a decision on which scenario we're going to pick. So no decision has been made yet. And the publication date, as I said, is late May 24th. Registration starts in June and orientations are in mid-June. So did I miss anything, Provost?
You rarely do, Mitch. I don't think so. I mean, I guess I would just encourage everyone on the call to, as indeed when President Schlissel visited a week or two ago, he said, what have we learned from the pandemic? What has, against all the odds, worked well, or we're doing things in a way that we we might want to continue. And I think that's an important important line of thought for all of us going forward. So, be thinking about the fall, as a continued transition, and and rethinking the way we do our work, and just that's all I would add to what Mitch said.
Thank you. And I know there's still a few questions that have come in about social distancing, and, Laura, I don't know if you want to take that, but I mean, how are we, I guess we'll follow the latest guidelines and guidance as to, what distancing should look like on campus, whether it be in the classroom or events or those types of things. Is that a fair thing to say?
Very fair, Ken. I think you nailed that one. Yep.
Okay. Okay, I'm just looking through questions. Again, if you have any questions going, this is probably the least amount of questions we received, during one of these town halls.
Can I just wanted to add, to Laura's comment, things could look better. And I think what we have to plan for, like, I don't want to say worst case scenario, but like the least normal. I don't know how to describe it, but it may be that we're not going to need 6 feet. It may be that you can have more people on campus, but right now, you have to plan at something, and it's better to plan less than more. I know there's at least a comment in there that, like, well, why even go back if it's gonna be the same? And I would say we really learned in the past year that classroom setting is not an unsafe setting. And I think the transmission that happens at work is people are piled in, they're eating. Most of the time it's food and drink, and they're not distancing, or someone comes to work sick. We've seen this at the health system, actually, because people are in small areas where we can't distance people. And again, we've been working the entire pandemic safely for the most part. And so I think we have learned that you can get back to classrooms, you can get back to labs, other places safely, but you do need to do the mitigation. And I think as more and more people get vaccinated, we're going to be able to drop some of the distancing requirements, because it's all a layered process. And again, eventually, we don't know when. I mean, this doesn't follow an academic calendar, unfortunately, in terms of, but I do think there's a big push to try to get vaccination. And I know someone asked about kids. The EUA application is in, I believe, for the 12 to 15. So I think you will see teenagers vaccinated before the academic year, which will be really great, before the fall term. But again, unknown right now.
And then another question in here, any insight as to when the emergency use status will be removed from the vaccinations?
I was thinking about that yesterday, actually, because now there've been like 200 million doses. And so there's a lot of experience. So the EUA is something that is, because we are in an emergency setting, it doesn't mean like it's like experimental. I mean, people use, there's a perception, I think, a misunderstanding of EUA, because it's not used very often. It was used during the 2009 H1N1 in order to like redose Tamiflu in children, for example. So it gets used for different things. The vaccine use is sort of a very unique use, but I actually don't know. But I think for people who are holding out for that, I would say don't, because it really is, it's this ongoing process. And, again, J&J, people have some questions about that. And the ASAP group met today, and, they're now, so there's been like 8, 9, close to 10 million doses. And there are 15 cases, and 3 deaths is what it looks like that are linked. So it is rare, but this is devastating. And the good news is that there's other vaccines to get if you are concerned about that one. So don't let the EUA bother you, I guess is what I would say. It doesn't mean it hasn't been tested, that it hasn't been vetted. It's just the kind of endpoints that you need for formal, usual vaccine approval can't happen in a quick manner.
Thank you. Brian, this question might be for you. Question about food service on campus, if we anticipate that happening in the fall and what that might look like.
I think, again, it's going to depend on what the fall plan is and how many students will be on campus. And I think we're always in talks with Picasso about what's happening and planning accordingly. So, I mean, if the students will be here, we want them to be served. And so we'll adjust our plans accordingly.
I know we're still getting some questions about how do we show test results and vaccinations. And again, we just don't know. As the chancellor mentioned, there's a lot of details that have to be figured out between now and September, but we have many months in order to do that. Okay, panelists, if you can just help me look through these questions. I think we addressed a lot today. So,
I did want to mention, I don't know if everybody saw this, but in the news this morning, the University of California and Cal State announced that they were going to require vaccines for all students, faculty, and staff. And the University of California system by itself has almost 300,000 students, just as a benchmark. And I think 150,000 employees. So it's a lot of people.
It is. International students. Yeah, this question has come up. Do we know yet how we're going to guide international students with vaccine requirements? Probably too soon on that too, but Sue.
Well, that is a good question. Who can I put on the spot? Thank you.
Yeah, I can comment
Dr.
because
Malani, please save me.
yeah, I guess what I would say to people who are listening in and are concerned about international students is that we'll have a system to accommodate them. This isn't meant to be punitive or to create barriers. If you can't get vaccinated where you are, or you're getting vaccinated with a vaccine that isn't acceptable here, and for example, in China, the Sinovac it is not very effective, and so they're going to sort of start from scratch there. But this has come up as, like, for example, in India, there's the Indian Serum Institute. It's an AstraZeneca type vaccine that doesn't have an EUA in the United States. And now AstraZeneca might get one in the coming weeks, but we're going to have to think about those things and like whether that's acceptable, because it would probably be a vaccine that's accepted in the United States, not just a local vaccine. And there'll be a lot of people who won't have access. And so when you get here, you'll have to plan ahead and make sure that you can accommodate people and get them vaccine. And I don't think that that's going to be a problem for us. A couple of weeks ago, we thought it would be J&J, and that's on a pause right now, and we'll have to see where that lands. And this gets at that issue of patients that I talk about, not so much that we should just all like not try to move forward, because I think there are things we can do safely. But for international students, this is going to be something that you'll have to communicate with. If they've been vaccinated, then we'll look at their information carefully. But it's not meant to be you can't come here because you didn't get vaccinated in your country. I want to be really clear on that. And I think depending on how many people are affected, and I think we'll have a number in Ann Arbor, we'll have a special clinic, or we'll say, on this day during orientation, we'll provide you with this vaccine. And of course, there is an opt-out also, but our hope would be to have everyone vaccinated.
Awesome. Thank you. So final comments from our panelists. I'll start with you, Brian. Anything to add or wrap up?
No, not really. I mean, mine's more budget focused, and again, we'll find out more as we, take a look at updating our projections and getting news from the state, and so, in the next couple of months.
Sue, anything to add to wrap up?
I just spotted in the Aaron's question, if we have questions about vaccine requirements for new students, who do we direct them to? So can we repeat what our best go-to is for information, current information on campus? And maybe we could get Amy to repeat the information about COVID, our COVID support line.
Yeah, absolutely. Yeah, and I know there's still questions in here too that
Yeah.
are very unique, and and I think those go under the umbrella that we don't know. And we have seen these, and there's going to be a lot of vetting over the next couple of weeks, to answer as many questions as we can to best guide the campus community.
And I'm happy to jump in as well. Thank you. So a couple of things I would just mention. Ken's team has done an outstanding job of maintaining a website that's very up to date with the latest information, requirements. That is a go-to place that I share with students all the time, and I would do the same for prospective students. But also prospective students should be getting a lot of communication from our admissions team in preparation for their arrival on campus. They'll be participating in orientation, so they will be hopefully positively overwhelmed with information. We also, as the provost mentioned, we also continue to support students, faculty, and staff through the COVID support line, where we're helping triage any student concerns, whether that relates specifically to symptoms or a COVID diagnosis, but also to mental health, financial support, food support, and reaching out to faculty if students are ill and not feeling well. So I just want to reiterate that continues to be available, and we take referrals from anybody that has them. So you can email Dearborn COVID support at umich.edu, Dearborn COVID support at umich.edu, or can call our hotline at 313-593-5056.
Thank you, Amy. Dr. Malani, any closing thoughts, comments?
Yeah, just again, thank you. So much gratitude for everything that all of you are doing. This is so hard. But as an educational institution and research and other things, of course, but I think it's amazing that they have found a way to continue their education. Hasn't been perfect. Certainly, I'm proud of the students and all that they've done. And I would just say, we're not helpless against this virus. We were a year ago, but we're not helpless. We know how to move forward. And I can't state it enough. Please get vaccinated if you have questions, if you have concerns. I would say to talk to a healthcare provider. I do worry about the misinformation that's out there. So please go and have a conversation with someone you trust. Your own doctor, if you have one. Really make sure that you're armed with good information so that you can make a good decision.
Thank you. And thank you again for joining us today. Chancellor Grasso.
I just want to thank Ken, you, first of all, for emceeing this. You did a wonderful job yet again. And I want to thank everybody on the senior leadership teams for working so tirelessly to come up with plans to help protect us as we go forward. I also want to thank everybody that's part of our community, faculty, staff, and students, for being flexible, adaptable, and really making it work for us and keeping everybody safe while we realized our mission first, people always, is no more true than on our campus. And I also want to echo Dr. Malani's last comment about please get vaccinated. There is a lot of misinformation out there. If you have questions, speak to your healthcare providers or go to reputable websites such as the CDC and do the research, but please get vaccinated. That is our safest course forward for sure. And the vaccines have been proven to be efficacious and safe. Nonetheless, we have a plan going forward in the fall that will allow us to return students and faculty and staff to campus as close to normal as we can and try to keep everyone safe. So with that, I'll turn it back over to you, Ken. And again, thank you all for all the hard work that you've done over this past year and the hard work that you're about to continue to do.
Thank you. And I just want to extend my thanks for all the panelists here today. Thank you very much. Thank you, IT, Kamal, and my assistant, Maria, for powering this up. Great job, guys. And I think that's really it. So a recording of this will be in Reporter at some point next week. Have a safe rest of the semester, finals. Hope for sunny skies and no rain for commencement in about a week. And, with that, stay safe, and we will see you very soon. Have a great weekend.
Go Blue.
Go Blue.